What is the risk of status epilepticus recurrence? Have you ever wondered about the chances of experiencing status epilepticus again after the first episode? The risk of recurrence can be quite significant. Studies show that cumulative recurrence rates range from about 16.7% to 26% within a few years after the initial event. Several factors influence this risk, including age, history of epilepsy, and the type of status epilepticus, whether convulsive or non-convulsive. For instance, one large study indicated that around 12% of patients had a recurrent episode after their first. By the fourth year of follow-up, the overall cumulative recurrence rate reached 26%. Certain factors, such as older age and a prior diagnosis of epilepsy, were linked to a higher risk. Non-convulsive status epilepticus and potentially fatal underlying causes also independently predicted increased recurrence risk. Interestingly, early recurrence, which occurs soon after the first episode, is associated with higher mortality compared to later recurrences. Another study highlighted a 3-year recurrence rate of approximately 16.7%. It pointed out that many risk factors for recurrence cannot be changed at the time of discharge, but understanding these factors can help healthcare providers plan better follow-up care for patients. Research indicates that recurrent status epilepticus is more common in older adults. This is often connected to underlying issues such as cerebrovascular disease, brain tumors, or withdrawal from anti-seizure medications. The highest risk of relapse typically happens within the first 6 months after the initial episode. However, the severity or refractory nature of the first episode does not reliably predict how severe subsequent episodes will be. In practical terms, individuals who have experienced status epilepticus requiring careful long-term management. This includes sticking to prescribed anti-seizure medications, addressing any underlying causes, and having regular follow-ups with a neurologist. Since recurrence can carry significant risks, especially if it occurs early, prompt medical attention and personalized care plans are essential. Overall, while the risk of recurrence is substantial, it varies based on individual clinical factors. Being aware of these risks can help support informed decisions in clinical settings and empower patients in their epilepsy care journey. Always consult healthcare professionals for personalized advice and management strategies.